Today, my name is Dr. David Horn. I'm the medical director. I'm joined by remotely various people. We're missing, I believe, two of our stalwarts, Scott Lindquist and Chris Spitters, who are responding to the COVID crisis. But we're also joined by Dr. Masa Narita, who's the director of the Seattle-King County Public Health TB Control Program, and also the director of the Washington State TB Control Network. We're also joined by Lana Tyre, who is the Washington State TB nurse, as well as additional people. I just want to highlight Mary Tunsil from the Washington State, from the Seattle-King County TB program, who is a key participant in our ECHO sessions. So ECHO stands for Extension for Community Health Outcomes. This is a telemedicine-based platform that was developed at University of New Mexico originally to provide care for patients with hepatitis C. It has been expanded across just a wide variety of diseases in many locations around the world. And its success is a credit to the platform and how good it is in achieving the objectives of enhancing care for various disease states remotely, as well as building capacity and creating experts outside of the ivory towers. What we do in our Washington State TB ECHO, and this happens every Monday from 12:30 to 1:30, unless there's a holiday, we provide consultations for clinicians working with patients who have TB infection, otherwise known as LTBI, or active TB disease. Participants after the discussion will receive within 48 hours a written case notes with our recommendations prepared by the TB ECHO panel. In addition, every other session, 2 times a month, we have didactics on various TB and latent TB related topics, for which, if you fill out a survey at the end, you can receive either CME or CNE continuing education credits. Mentoring from TB specialists is available through ECHO, but we also can provide it outside of ECHO sessions if there is an urgent need. ECHO is wonderful because it's an ability to participate remotely. It's free, easy to use technology, and in the past, and I believe into the future, we can provide cameras for those who are not camera equipped. We welcome you to enroll in TB ECHO and just visit our website. If you have any questions, you can email Lana Tyre. And a final reminder to complete the evaluation form, which is the green button in the email invite at the end of the session to receive CME and CNE credit for today's session. And thank you to the Curry International TB Center at the University of California, San Francisco for providing the CME and CNE credits. So I think we can jump to slides, is that right? So we can advance to slide 3. And one more. There you go. So thank you. We are TB for facilitating our TB survivor presenter today. We Are TB offers comprehensive peer support for current TB patients in TB clinics. We Are TB is a growing survivor network that is fighting to achieve change in TB diagnostics, treatment regimens, and funding to support US-based public health programs. The group specializes in connecting medical professionals and current TB patients to TB survivors. We Are TB brings an unparalleled depth of knowledge and provides compassionate support while using personal stories to empower survivors to break the stigma. So, bios from today for our 2 presenters. Most of you know Lana K. Tyre, who is our TB ECHO coordinator and the TB nurse consultant for Washington State Department of Health for the past 5 years, which means she's been with us at TB ECHO since the beginning, since we started in fall of 2015, and we're rapidly approaching our 5th year. Kristen is a product designer in San Francisco, California. She has a degree in molecular and cell biology from the University of California, Berkeley, met her husband in college, and has traveled all over the world. She was diagnosed with tuberculosis in August of 2016 after 8 months of misdiagnosis. She is happy and healthy now and traveling again. And I joined early. I believe I saw like a little person that was not her husband who was also looking pretty happy. So with that, I will hand it over to Lana.
Okay, thank you all for being here today. Randy, next slide, please. So these slides will present a brief overview of tuberculosis epidemiology in Washington State before our featured speaker presents. The intended speakers of this presentation could not be here today due to our Department of Health collective work on COVID. I will continue to support TB work at this time, but all of our capacity at the agency is limited to ensure fulfillment of our continuity of operations plan. Much of this work you're seeing here today was done well before our capacity was limited, and that is the only reason why we're able to do this today. Since I'm covering this presentation, I will be somewhat limited in my ability to be able to answer questions. But at the end of the slides, you'll see contact information for the Washington State Department of Health TB program. Next slide. I have no disclosures. Next slide. The objective that I'll be taking care of today is to summarize national and state TB trends to improve timely screening for populations at risk. Next slide. This map shows relative tuberculosis incidence by state. Those states shaded in yellow are below the national average, and those shaded in dark blue are at or above the national average. When considering incidence rates by reporting area in 2019, Washington is at or above the national average of 2.7 cases per 100,000. Next slide. This graph displays reported tuberculosis disease cases for the last 27 years in Washington State. Over the last 10 years, Washington has seen between 185 and 255 reported cases of tuberculosis disease per year. In 2019, there were 223 cases of TB counted in Washington State. Next slide. Since 1993, incidence rates of TB in Washington, shown here in the solid blue-green line, have progressed downward overall, similar to the trends seen in the United States as a whole, represented by the red dashed line. In 2019, TB case rate in Washington was 3.0 cases per 100,000 people, slightly higher than the national average rate of 2.7 cases per 100,000. Although these trends overall represent progress in testing and treating TB, the current pace of decline remains slow and insufficient to achieve TB elimination in this century. Next slide. This map of Washington State is similar to the one we saw for the United States as a whole. Washington counties colored in the darker blue-green shade represent those with a TB case rate above the state rate over a 5-year period. Those colored in the lighter shade represent those counties with a TB case rate at or below the state rate over that time period. You may notice a few Washington counties that are shaded in gray, which here represents those counties with no reported TB disease cases over this time period. TB disease occurs in most areas in Washington. Next slide. This slide shows TB case rates by age group and sex at birth. Males are shaded in the lighter color, and females are shaded in the darker color. From 2015 to 2019, significantly greater risk of TB was experienced by males compared to females. Over the same period, when stratified by age group and sex, as presented here, males age 65 and over experienced the highest case rate compared to all other groups. Next slide.
And your audio's not working.
Oh, sorry about that. Okay. This slide represents risk factors for thinking about TB disease. This slide shows, so many risk factors that we're talking about here, being exposed to TB or risk of progression to disease. So from 2015 to 2019, Washington residents born somewhere other than the US and its territories accounted for 78.4% of TB cases in Washington. TB is more prevalent in certain parts of the world than in the US, and therefore the risk of exposure to TB is greater in those areas. During the same 5-year period, 7.1% of TB cases in Washington were a known contact of a person with infectious TB within 2 years prior to their TB diagnosis. And certain medical conditions can lessen the ability of the immune system to keep TB infection from progressing to TB disease. Diabetes is one example. 19% of our TB cases in the 5-year period also had a diagnosis of diabetes, and therefore and before or during their diagnosis of TB. Next slide. So drug resistance is a concern for successful treatment of TB. There are different types of drug resistance in the world of TB. Here we focus on MDR, pre-XDR, and XDR TB. Multi-drug resistant TB, MDR, shown in the blue-green color, is defined as TB that is resistant to at least isoniazid and rifampin. As you see, MDR TB accounted for less than 2.5% of our reported TB cases each year that we tested for resistance. In 2019, you can see an additional light green color bar on this graph. This represents reported TB cases in Washington that were considered pre-XDR TB. So that is MDR TB resistant to INH and rifampin, plus resistance to either a fluoroquinolone or a second-line injectable drug. In 2019, 2.3 of our reported TB cases were tested for resistance and considered pre-XDR TB. You will also notice that you do not see any red XDR TB cases on this graph because Washington State has not had any cases reported as such. Next slide. In most cases, TB is treatable and curable. However, persons with TB can die if they do not get proper treatment or experience delayed diagnosis. Among TB cases diagnosed in Washington from 2015 to 2019, less than 8% of patients died before diagnosis or during treatment. 43% of those deaths were attributed to TB disease or TB treatment. Next slide. As mentioned earlier, TB is more prevalent in certain parts of the world than the US, and therefore the risk of exposure to TB bacteria is greater for persons in those areas. Among persons born outside of the US diagnosed with TB in Washington State from 2015 to 2019, 13% of those cases were diagnosed within 1 year of arrival to the US. You may notice on this graph that 27.8% of cases were diagnosed 20 or more years after arrival to the US. These cases may in part represent persons with latent TB infection who developed TB disease in later years. Next slide. So tomorrow is World TB Day. TB continues to disproportionately affect certain populations, and the CDC theme for 2020 is it's time to test and treat for latent TB infection. It's time to end stigma. It's time to end TB. Next slide. Please feel welcome to contact us at the Washington State Department of Health TB program. Our contact information is listed here and also available on our website, which can be reached by searching Washington State Department of Health TB program or navigating to the URL shown here. Thank you everyone for being here today and letting us share this information with you.